Good morning, everyone. How are you today? Good. I'm going to go over the impacts and operational challenges that we're seeing with the HIPAA reproductive rule. How many are familiar with the rule? All of us? Okay. Um, how many have started to train staff and started to go through implementation? A little bit? Okay. We can pause at any time. We can stop and ask questions. What we've found most helpful about this conversation is when we hear from other people talking about the own impacts within their systems. And the dialogue between that has really been helpful to clients. So I'm going to go through each part of the rule and the impacts that we're seeing with that certain part of the rule, and then the operational considerations that we want to make sure systems, hospitals, and clinics are focused on when going through and putting this into practice. I'm Tucker Bair. I am the Deputy General Counsel and Chief Privacy Officer. So overview. So we all know why this is here following the Dobbs decision. We wanted to create more concern for the confidentiality of reproductive health. And the design was to prevent that information from being used or targeted inappropriately. It represents the most significant change that we've seen in HIPAA in a while. But with that has come a lot of severe impacts to how we can operate. There are also recent challenges. We were all expecting this. I think it happened a little later than we thought it was going to. But on September 6th, as well as on September 24th, there have been two challenges, both in Texas, saying that the law violates what is intended in HIPAA and how we can effectually and how we can impact it. So we don't have a decision yet. December 22nd is the go live date for this rule. We're probably going to see something before then. But until then, we don't know. So we have to continue full steam ahead as if we're going to implement this and on the 22nd. All right, I'm going to put this up here and I'm going to go back and refer to it a couple times because this is, in a nutshell, what we need to really focus on for the reproductive rule. So this starts, the request is made for one of these four categories. I'll move over. I don't want to be in your pictures. Okay. And then this is going to go through a decision tree of can we release the information or do we need more information? So the request is made for, the request is for a prohibited purpose. If we don't know the request is for a prohibited purpose, does it contain PHI potentially related to reproductive health care? Then we need an attestation. On the other side, if we do know it's for a prohibited purpose, do we have a HIPAA authorization or a patient access request? Is the regulated entity, have they provided the care? And if so, do we have the rule of applicability or has it overcome the presumption of lawfulness? That's a lot, right? I'm going to walk you through each of those steps, but each time I do, we can refer back to this to understand kind of where it fits in. When I've been talking about this over the last couple months, we used to put this at the very end, and I think people were waiting for this to see how it all fits together. But I think putting it at the beginning alleviates some of the puzzle piece that you're trying to put together in your own mind, right? So this is the final piece of the puzzle. We put it all together. Now we're going to walk through it. All right, so impacts. I'm going to run through these. If you know or if you want to ask questions, please let me know. I know the rule has been out since April. We've been talking about it a lot, but I want to highlight some of the impacts we're going to see. So the definition of person. The definition of person is a natural person, meaning a human being who is born alive. This definition competes with certain state laws. So the impact here is that you're going to receive a request for medical records of an unborn fetus themselves and or female patients who are pregnant. And there is going to be a conflict between this rule and state law. Now, we in and of ourselves can't say, go with this one or go with that one. There's going to be an inherent conflict there that we're going to have to make sure we're ready to escalate properly and then decide. Reproductive health care. This definition has given me nightmares since I first read the rule. These are a non-exhaustive list of the types of information that would apply, but now healthcare systems have to come up with their own list of what is reproductive health care, right? And so as you know, this list is far from exhaustive. And if we go through what reproductive health care is, most notes or doctor's visits are going to include some type of reproductive health care. When was the last time you had your period? When was the last time you had a mammogram? All of that can be considered reproductive health care. So now that information is in every single doctor's visit. So it's encompassing almost everything when it comes to these medical records. We've talked with a lot of clients who are going to go through and list out what reproductive health care is versus they're just going to say, we're checking everything, we're getting an attestation for everything, and we'll talk about that a little later, because trying to come up with this list has been almost impossible. Doable, but guaranteed compliance is what we're looking for, and coming up with that list and then cross-referencing it, very difficult. That's what I just said, but I think it's very important that we put that on a separate slide because we want to make sure that we understand the impact here. Purpose-based prohibition. So this purpose-based prohibition is if you receive a request from one of those four categories and the request is for a prohibited purpose, health oversight activities, judicial or administrative proceedings, law enforcement purposes, coroner, and medical examiners. You are prohibited from using or disclosing the information if it's for one of those three purposes. How many times are you receiving a subpoena and it is telling you exactly what it's for? Never. It's saying any and all, right? It's saying something very vague, legal request. So in making this rule, they thought that, oh, all of these requests on their face, they're all going to know. I think this is going to happen a very small percentage of the time. It's a big chunk of the rule, right? Because we're going to go through if it's for a prohibited purpose and you have a HIPAA authorization or a patient access request. And if you don't, you have to go through these tests. I'm going to run through them, but I don't think that we're going to see these come over where the request is going to say this is to conduct a criminal investigation, right? So we're not going to have that information. Again, the requests are detailed, clear, and narrowly tailored. The purpose-based prohibition contemplates this smoking gun that we're not going to have. However, if we do, there's a couple tests we can run to see if we can release the information. So a regulated entity is prohibited from using or disclosing PHI potentially related to reproductive health care for a request that is made for a prohibited purpose when the regulated entity determines the reproductive health care was lawfully provided. How do we determine that? Lawfulness is determined by the regulated entity that receives the request. You can look at the rule of applicability or the presumption of lawfulness. Again, I'm going to go through this, but this is when the request is for a prohibited purpose. This is when the request says, I'm doing this. And a lot of times we're not going to have that. Any questions so far? So, the rule of applicability is used when the regulated entity that received the request provided the relevant healthcare at issue. So if the regulated entity received the request and provided the healthcare at issue, rule of applicability. Presumption of lawfulness is used when the regulated entity did not provide the healthcare. Same page so far? Okay. The impact is that we have to be able to distinguish these frameworks. And I'm going to go through them on the next slide. But I want to be clear, this is when the request is for a prohibited purpose on its face. Rule of applicability. The rule of applicability applies when the request for PHI is made to the regulated entity that provided the healthcare. Does one or both of the conditions of the rule of applicability apply? The reproductive health care is lawful in the state, and the reproductive health care is protected, required, or authorized by federal law, including the United States Constitution. If the answer to one or both of those questions is yes, disclosure is prohibited. And again, we'll go back to that decision tree when we're done here, because that's all going to flow for you. If the regulated entity did not provide the relevant reproductive health care, you have to ask yourselves these two questions. Actual knowledge that the reproductive health care was not lawful, or other factual information supplied by the person requesting the use or disclosure of protected health information that demonstrates a substantial factual basis that the reproductive health care was not lawful under the specific circumstances. That's a lot to put on our systems and our clients and a provider and a regulated entity. So it's only when you know the request is for a prohibited purpose. And again, just so we know, and we're all on the same page, we're on this side of the decision tree. So all of that is still this side of the decision tree. Request is for a prohibited purpose. True. Request is a HIPAA authorization or patient access request. No. So regulated entity provided the healthcare at issue. True. Rule of applicability. False. Presumption of lawfulness. Right? So ton of information, but if you keep going back to this, it starts to flow within and you kind of can understand it. At least I can. Took me a couple months to get to this portion. Yeah, right. I'll tell you, I was stuck in this part of the rule for a while. I was stuck in this part of the rule for a while. And it wasn't until you realize the request on its face is for a prohibited purpose, this is where you're at, right? Now, the attestation requirement. If the request is not for a prohibited purpose, then the covered entity must decide if the request has PHI potentially related to reproductive health care. That's where that definition comes in, right? Does the request have PHI potentially related to reproductive health care? But again, the definition of person, not specific to male or female, and has no age requirements. So they're not limiting this in any certain form. So we get a request for Tucker Bair, 78-year-old male. I'm not 78, but for the purposes of this, 78-year-old male. Thank you. Thank you. The work's paying off. Do we have to make a determination there? Under the rule, yes. right? Can we limit it to gender? Can we limit it to age? Some people want to. Some people think you can. Some people think there's less risk, right? Under the rule, though, it's difficult. So, if the request is not for a prohibited purpose, right? Subpoena, any and all, legal reasons, we don't know if that's for a prohibited purpose. And that's what, 99% of what we're seeing, right? Then we must determine if the medical record has PHI potentially related to reproductive health care. Go back to that list, the definition, the non-exhaustive definition of what PHI potentially related to reproductive health care is. So here's the determination. Do you make a list? Do you go through and say, these are all of the things I'm looking for? Or do you just flat out say attestation requirement across the board? Because now, if we're going through the list, we have to check every medical record. We have to cross-reference that with the list of PHI potentially related to reproductive health care. And then we have to see if that record has it. Or do we say, you know what? We need an attestation for all of these. The attestation requirement would apply to the following request when the request is not for a prohibited purpose. Health oversight activities, judicial and administrative proceedings, that's going to be a big one. Law enforcement purposes, and then coroners and medical examiners. The impact here is that the attestation requirement would be in addition to the established safeguards required for such disclosures, including satisfactory assurances for subpoenas. None of the other things are going away here. And then notice of privacy practices, I think the least impactful, but just so you know, it has to be updated by February 16th, 2026. The rule goes into effect December 22nd, but they're giving you some time to update your PNP. So, before I get to operational challenges, does this make a little bit of sense now? So what I think we are going to see a lot of is this side of the board, right? We're going to get a request for one of these 4 reasons. Is it for a prohibited purpose? Chances are we don't know, so we're over here. Does it contain PHI potentially related to reproductive health care? 2 options. You can flat out say, yes, attestation requirement, or we can create a list of PHI potentially related to reproductive health care, and we can cross-reference that with the medical record. If it does contain PHI potentially related to reproductive health care, we need a valid attestation. In addition to all of the other timeframes we need with our subpoenas and everything else there. Does this decision tree help put the puzzle pieces into place with what we're looking at here? Any questions about this portion? Yes.
So I know, and I've been working closely with you with this, but what have the attorneys and the court systems know about this and how this is going? Because that's where we're going to get the pushback from these attorneys.
So that's a good question. The question was, what do the court systems and the attorneys, the third-party requesters, what do they know about this? Good chance today, not a lot. What we are seeing is a lot of our clients and a lot of providers and a lot of regulated entities are doing some outreach. They're reaching out to these offices, to the coroner, the medical examiner, the police within their town, right? They're big requesters. They're going through and looking at the past year. Who's requesting these records, right? And then they're doing some outreach and they're saying, hey, this is coming December 22nd. We're going to need this. They're doing a little bit of education, right? They're creating like a 1-pager, an FYI, an FAQ of this is coming. We have to comply. You have to comply. You want the records. The attestation is going to be required of you. So there is a little bit of educational outreach there. And then on our end, what we are going to do is we're going to make sure that the letter back explaining that we need an attestation very clearly articulates the law, the reasoning in layman's terms, that we want to make sure this request is getting out, but we need one more additional piece of information.
Not even bothering, maybe just
Pardon me?
Where the patient has a transgender or
Mm-hmm.
later in life, when patient admitted somewhere, a physician, like you can say, this is a transgender patient.
Yep.
So he mentions that this is a transgender patient. So does it apply to which case or all cases?
So the question was, what are we doing in terms of transgender and transgender care? This rule applies. There is no gender specifics on this rule. And I think purposefully that was the reason. They didn't limit this to male, female. They're including transgender and non-binary care in this. And I think that was extremely purposeful. Yes.
Just make sure I understand the prohibited purpose. Purpose-based provision only applies to these four categories. So, a patient requesting their own
Correct.
personal representative,
If
they reason of
correct. Correct. Well, we care, but yes, for the rule, we don't. The rule, so the question is, this rule only applies when the request is made for these four categories. So if it's a patient requesting their own record or a personal representative, that's not going to fall into these four categories. This rule only applies when the request is made for one of these four categories. Snap a picture of this. We regulatory counsel and myself worked through this rule all of April. Well, I was on paternity leave in April, and I read the rule, and I was like, there's no way this is going to go through. I'm never going to have to learn it. Flash forward to, it's still here. This is again, all of these slides we went through, and then we finally figured out the decision tree helps organize it to help make sense. Operational challenges. All right. I have 8 operational challenges. These are more for when we're looking at how to operationalize this, how this is going to impact us, what decisions you need to make at a facility level, at a provider level, to understand how we make this work on December 22nd. If the request falls within one of the 4 categories, is your facility limiting your analysis to only certain patients based on age? The reason I ask this, we have some facilities who are saying, you know what? Tucker, 78-year-old male, probably not, very low risk, we're going to limit it. Not wrong, creates a little bit of a risk, but is your facility going to limit based on age? Answer could be no. So then a third party is going to request records for a 99-year-old woman, and you're going to say, I need an attestation because there could be reproductive health care here. They're going to say, what do you mean? And we're going to have to say, hey, listen, I have one of 2 options. I could maybe be compliant, or I could for sure know I'm compliant. Neither are wrong, low risk. However, guaranteed compliance versus not sure is what we're looking at there. To your question, if the request falls into one of these 4 categories, is your facility going to limit based on a certain gender, right? Again, some are saying we're going to limit this based on females. Males aren't going to have this information. I think a lot of times, males, transgender, non-binary, they're all going to have a certain piece of reproductive health care within their records. And I think a lot of times when we look at that gender spectrum, a lot of this could be what the rule is intending to protect. But it's a question you're going to need to answer. If the request falls into one of those 4 categories, are you limiting it based on age, based on gender, or based on other criteria? And what is that criteria? And the reason I'm asking these questions is because I think prior to December 22nd, you should have these questions answered. You should say yes, no, no, yes. We at least have the framework there. We're building out the framework to understand a request comes in. It doesn't matter age or gender. We're requiring an attestation, or we're checking for PHI potentially related to reproductive health care. If the request falls into one of the 4 categories, on its face, for a prohibited purpose, is your facility honoring a HIPAA authorization and releasing the records? Same question, are you honoring a patient access request to a third party? Here's why we ask this question. We have third-party requesters that have patients sign a HIPAA authorization, and we have third-party requesters that could have a patient access request. And the question here has come up, does the patient know what they're signing the HIPAA authorization for? The presumption is yes. They signed it. They know why they're releasing the records. They know why they're asking to release the records. But we have certain third-party requesters who we're not sure if they're giving away all of the information. So is your facility going to take an extra step? And again, this side, if it's for a prohibited purpose, are we requesting a HIPAA authorization, and are we just taking that authorization on its face? You can, you're allowed, it's in the rule, it's fine. I'm not saying you shouldn't. We have some clients who are saying, I'm going to call that patient just to make sure. I'm going to call that patient and say, hey, you signed a HIPAA authorization. Do you know why? And are you okay with us releasing our records? It's a question that has come up enough that I wanted to put it in here because, again, the answer can be yes. The answer can be no. It's not wrong or right here. It's a determining factor that I don't want December 22nd that you are then trying to answer the question at that moment. It's all of these that we need to answer now, right? This is the biggest question to me. If the request falls into one of the 4 categories, it not on its face for a prohibited purpose, is your facility going to determine if PHI, potentially related to reproductive health care, is in the record? Or are we assuming it's in the record and requiring an attestation for 100% of the crop? It's a big question. I think it has to be answered before the 22nd. I told our clients, if it's not answered then, and on the 23rd, when I'm trying to wrap gifts, and I'm trying to put the final touches on my bows, if we still don't have this answered, I'll take the call, but. HHS came out with a model attestation. The question here is your facility using the model attestation form? It doesn't say you have to. However, your form has to have all of the same elements. There's not a lot of wiggle room. The only thing we've seen clients do is they want their own logo, and they're actually removing any blank spaces so you can't write outside the lines. They wanted to make it a little more locked in. The next question, if your facility is not using the model attestation form, are you still going to accept it? right? Because what I foresee is coroners and medical examiners are going to maybe start sending the form with their request. They're going to be hip to this. They're going to say, all right, I know you have to comply. I know I have to comply. I don't want to wait an extra 5 days for you to send me this form. Here you go. Here's everything you need. Are you using the model form? If no, are you accepting the model form anyways? To me, I think that should be yes. If you're not using it, fine, should still be accepting it, but it's going to be a question that comes up in your facility that we have to think about. That's that question. Lastly, checklist. This is what I think we should all be doing before the 22nd. We should be defining this. Reviewing your state law to make sure, does your definition of person and HHS's definition of person conflict? Obtain or develop an attestation form. Update your HIPAA policies and procedures, right? All of this is going to impact your internal policies and procedures, how you release information, how you're releasing records. Update or develop training. This, to me, is something that the entire organization needs to know about. We've done 3 levels of training, right? We have ground training. That's your 20, your 30 slides. Here's everything you need to know. Here's what you need to put into place. Then we have a step up, 5 or 10 slides. Here's the high-level pieces that you should be able to answer. Then we have your 1-pager FAQ that everyone else is getting to at least know that this is coming and to know why people are a little freaking out. Notice of privacy practices. This is the only one you have till 2026. Identify any necessary EHR updates. When I say this, I say, do you have flag systems? Can you flag this? What's the problem there? If we're flagging PHI, potentially related to reproductive health care, every single record is going to have a flag. So what does that flag mean to the person trying to release records? But do we need any updates there? Talk to your security officer. Understand if there's any impacts there. We think that this is a whole system-wide knowledge that we need to make sure people are aware about. Evaluate contractual requirements where applicable. And then figure out your point of contact. Like I said, we already have timing requirements with a lot of these requests, right? Subpoenas, we already have timing requirements, and now we need an attestation before we can even release this on top of that. So who is your point of contact? It is our opinion that you should have privacy or compliance, a legal person, and someone from HIM, in a little triad of this is my escalation team, this is who we're going to when we have questions. Because what's going to happen? You have a question. I think I should go to Tucker. I think Tucker will answer it. Tucker's going to bounce it to Matt. Matt's going to bounce it to Lydia. Well, now it's been 5 days, and you have no clue. So a point of contact is extremely important here to understand who you're going to go to. And then continue to check for updates, but we are checking for updates every day, and we will get them to you as soon as we can. So, any questions? I will end it where I started it, because any questions? All right. Well, thank you all for coming out this morning. Oh, wait. Did everyone get a ticket? I have a raffle to give out. All right. What do I do? Just take